Welcome to Magic Moments with the Medicare Professor. I'm Patricia Mitchell, your host. Thank you for tuning in today to learn all about Medicare. Today we're going to review Section 1 of the Medicare and You manual. We just finished with the Getting Started section, so let's get started with Section 1. Who gets Part A and B automatically? If you're already getting railroad benefits from Social Security or the railroad retirement, you automatically get Part A and B. Starting the first day of the month you turn 65, or the first day of the month you're eligible because of a disability. If you're under 65 and have a disability, you automatically get Part A and B after you get your disability benefits from Social Security. Now, if you have ALS, multiple arterial sclerosis, also called Lou Gehrig's disease, you'll get Part A and B automatically the month your Social Security disability benefits begin. Now, if you automatically enroll, you get your red, white, and blue Medicare card in the mail 3 months before your 65th birthday or 25th month of disability benefits. You don't need to pay a premium for Part A, sometimes called premium-free Part A. If you don't want Part B, let Medicare know before the coverage start date. And again, if you choose not to get your Part B and decide you want it later, you may have to wait to enroll and pay a penalty for as long as you have Medicare Part B. So we're going to talk about that a little bit later. Who should or should not get Part B? Because if you don't have other credible coverage and you delay your Part B, then you are susceptible to a 10% penalty. So who has to sign up for Part A or Part B? If you're close to 65 but not getting Social Security or railroad retirement benefits, you need to sign up for Medicare 3 months before, okay? And you sign up for Medicare through Social Security. Now, because of COVID-19, most of the Social Security and Medicaid offices are closed. So a lot of what you are going to have to do now is on the internet. And we provide services to you to help ease and help you through that transition of applying for Medicare, applying for Medicaid. We help you with those needs. Now, if you don't get enrolled in Part A and Part B automatically, there are certain times of the year when you can sign up. If you didn't get automatically enrolled in premium-free Part A, for example, because you're still working and not getting Social Security railroad retirement benefits, you can sign up premium-free if you're eligible anytime during or after your initial enrollment period begins. If you're eligible for premium-free Part A, you can enroll in Part A anytime after you're first eligible for Medicare. Part A coverage will go back retroactively 6 months when you sign up, but no earlier than the first month you're eligible for Medicare. You can only sign up for Part B during the periods listed below. So what are the Part A and B sign-up periods? Your initial enrollment period. This is important. You can sign up for Part A and Part B during the 7-month period that begins 3 months before your Medicare effective date, the month of your Medicare effective date, and 3 months after. Now, if you go for 63 or more days without getting that Part B or Part D, you may be susceptible to that penalty. Now, some people qualify for a special enrollment period. After your IEP or initial enrollment period is over, you may have a chance to sign up for Medicare during a special enrollment period. So, for instance, if you're still covered by a group health plan, and you're losing that coverage, you may qualify for a special enrollment period. During the 8-month period that begins the month after your employment ends, if you're retiring, you may be eligible for a special enrollment period. Usually you don't have to pay a late enrollment penalty if you sign up during that special enrollment period. Again, you cannot go 63 days or more without having credible coverage, or you may pay a penalty. COBRA plans are the most expensive type of coverages there are, coming from an employer group plan. You aren't eligible for a special enrollment period to sign up for Medicare when that coverage ends, because COBRA, let's read it. COBRA, retiree health plans, VA coverage, and individual health coverage, like through Health Insurance Marketplace, aren't considered credible coverage based on current employment. Read that again, y'all, because this is important. I find people who have a late enrollment penalty because they didn't read this manual. So again, COBRA coverage, retiree health plans, VA coverage, that's my military people who aren't TRICARE, VA coverage, and individual health coverage, like through the Health Insurance Marketplace, aren't considered credible coverage based on current employment. You aren't eligible for a special enrollment period to sign up for Medicare when that coverage ends. To avoid paying a higher premium, make sure you sign up for Medicare when you're first eligible. The general enrollment period. So I have some people who did miss their enrollment period. They have to wait until January today. So if you did not get your Medicare Part B when you were first eligible, January 1st is the first day that you can sign up for your Medicare Part B. And that ends, as you see on the screen, that enrollment period ends March 31st. The general enrollment period ends March 31st. Now, because you enrolled in your Part B during that general enrollment period, January through March 31st, doesn't mean your plan is going to start then. Your Medicare coverage doesn't actually start until July 1. So for those people who are turning 65 within the next year, make sure you share this video with your classmates. And we do turning 65 birthday parties as well. So contact us for more information about that, because we do a full seminar, and we can do it virtually as well for people turning 65, because you all don't know this information, but after today you will. So call us, okay? So general enrollment period. Should I get Part B? Should I get Part B? I'm a pastor. I'm not a pastor, but I'm going to give you a scenario. I'm a pastor. I have VA coverage, or my church has been paying for health insurance for me, right? And so when you retire from pastoring, you now only have your VA coverage and you don't have any other coverage, but you did not get your Part B when you were first eligible. And those other two coverages aren't considered credible coverage. So now you have a late enrollment penalty because you didn't sign up when you were first eligible. You're a veteran. Here's another scenario. Again, I have a lot of veterans, a lot of VA clients, TRICARE clients, CHAMP VA clients who did not understand this part, okay? So if you or your spouse or family members have a disability, is still working, and you have health coverage through an employer or a union, contact your employer or union benefits administrator to find out how this coverage works with Medicare. Now, again, coverage based on current employment that's not considered credible is COBRA, retiree coverage, VA coverage, or individual health coverage like through the Health Insurance Marketplace. Those are not credible coverage. And once you turn 65 and you're eligible for Medicare, you aren't even eligible for health insurance through the Marketplace. If you're not familiar with the Marketplace, that's what they call Obamacare, which that's not the name. It's called Affordable Care Insurance. Now, TRICARE, I'm going to come back and do another video later because these are the hardest people to get to understand what they're eligible, because you have presidential coverage. You have no out-of-pocket costs, right? But TRICARE, if you have TRICARE health program for active duty and retired service members and their families, you generally must enroll in Part A and B to be eligible to keep your TRICARE coverage. So you're turning 65 and you have TRICARE Prime. And in order to get TRICARE for life, you have to get Part B. It's $148.50 in 2020. It was $144.60 last year. But you cannot delay your Part B. You can't opt not to get it, because if you don't get it, then you don't get TRICARE for life. Okay? And it's right here in black and white. It's not what Patricia said, it's what we both read. You have to get your Part B. Now, once you get your Part B, then you're eligible to get what's called a Part C plan, and most of them at no cost to you. You're able to add additional vision, dental, and along with health coverage that you can use your card outside of the VA. Okay? So, TRICARE, we're going to do another segment on that. Now, Medicaid, we're going to do another segment on that as well. If you have Medicaid and don't have Part B, Medicaid may help you pay for that Part B coverage. All right? Now, how does mild insurance work with Medicare? This is a topic that I get a lot of questions about. Who pays first? There's a discussion about who pays first. So it states it all right here very clear. But again, people don't read this manual. So we read it for you. Okay? If you have retiree insurance from your spouse's former employment, Medicare pays first. Now, these may be questions at the end for a quiz, so make sure you pay attention. Retiree insurance from your spouse former, and that's the key word, former employment, Medicare pays first. If you're 65 or older and have group health coverage based on your spouse current, and that's in bold, then your group health plan pays first, not Medicare. If you're 65 or over and you have group coverage based on your spouse's current employment and the employer has fewer than 20 employees, Medicare pays first. So the number of employees counts. And then vice versa, 100 or more employees, your group plan pays first. Okay? So now it's all in black and white. If you have Medicaid, Medicare pays first. All right? And we can talk about that more one-on-one. Now, Part A generally is zero premium. And this is a test question. You had to have worked 10 years or 40 quarter hours to qualify for Medicare A, Part A at no cost. Part B, there is a premium for Part B when you're eligible for your Part B. Now, the Part A late enrollment penalty. We don't see too many people with the Part A late enrollment penalty because it comes automatically if you've worked those 10 years or 40 quarter hours. Now, Part B, it shows you the cost. This is a 2021 book, but it was printed in 2020. So Medicare hadn't established at the time what the 2021 rates would be. So the 2020 rates was $144.60 for Part B, but in 2021, it's $148.50. And it tells you about that there. Now, we do see this one a lot, the Part B late enrollment penalty. And again, if you don't sign up for Part B when you're first eligible, you may have to pay a late enrollment penalty for as long as you have Part B. And it's based upon a 12-month span. So 10%. So if your Part B started in 2015 and it's now 2020, you may have a 5 or 6 year penalty times 10. So that's a 50% increase in your Part B premium. And they give you an example here about Mr. Smith, right? So you 50% of 148.50, that's a lot of money added to that you'd have to pay. So think twice about delaying that Part B. And if you're not sure, you can always give us a call. If you're not sure, you can always give us a call. So make sure our number will be all over this video and at the end of the video. And there's a contact information sheet where you can contact us, fill out that information, and send it to us. And one of our team members, we have about 15 agents on our team. And so somebody will contact you. You send in that contact information. And we're licensed in 13 states. And we're continuously getting a license in other states based upon referrals from our existing clients. So don't think you have a family member that we can't help. We can help them for sure. So we've gone over section 1. Again, you can always contact Medicare for more information. You can always contact Social Security for more information. And you can also contact the Medicare professor, Patricia Mitchell, 912-667-3949. My husband, Gregory Mitchell, 912-667-1650. Stay tuned for the next video.